The flu is a complicated and contradictory disease. On the one hand, the amount of American lives it takes in a single year can range from that of the entire Korean War all the way up to the entire Vietnam War. But on the other hand, most of your patients probably think of the flu as just a bad cold. It's just part of winter. And if you get sick, you just dive under your blankets until it passes. And for most, that is the experience of a flu, so they don't see much reason to go out of their way to get the flu vaccine every year. But as a clinician, you need to be aware of the fuller picture and how the flu is a deceptively dangerous pitfall that hospitalizes hundreds of thousands of Americans every year, especially those with pre-existing heart and lung disease. So you know that all these dangers are why flu vaccines exist in the first place, but what do you do if your patient avoids or even pushes back against vaccination? We think asking your patient why and taking some time to answer their questions head-on is key. So let's go through some of the more common questions and concerns that you might run into. Number 1. But don't vaccines have mercury, formaldehyde, or aluminum in them? This question will most often be coming from pregnant patients who are living through the most risk-sensitive portion of their lives, and they're second-guessing everything that they eat, drink, put on their skin, and so on. So please take your time to address these questions instead of just dismissing them or avoiding the topic. So there is technically a very small amount of mercury in certain vaccines, but 1, it's not the kind of mercury that causes mercury poisoning, and 2, it's only in the multi-dose version of the standard vaccine, which is rarely ever used these days. Thimerosal is the preservative they're probably talking about, and it's used to prevent bacterial contamination. But it's made from ethyl mercury, which clears from the body more quickly, not methyl mercury, which is found in certain fish and can accumulate in the body over a lifetime. Formaldehyde is used more commonly in vaccines, mainly to inactivate viruses during the manufacturing process. The problem is that the general public associates it with embalming fluid, where it's just one of many ingredients, but what they need to realize is that they already have much more formaldehyde naturally occurring in their own bodies than will ever be in a vaccine. The dose makes the poison, as they say, and this dose is so minuscule that it's no threat at all. Finally, aluminum also exists in many vaccines in the form of aluminum salts, which help boost the immune system response to the vaccine to make it more effective. Your patients, however, might already be used to seeing aluminum-free deodorants filling store shelves, so it's easy for them to assume that it must be bad to use in all contexts if it seems bad in just one of them. Again, aluminum salts are present in such low amounts that they pose no safety concerns, and your patient probably already buys them without knowing it when they use buffered aspirin or antacids or many infant formulas. Number 2. It doesn't even work all the time. Well, no treatment or precaution is 100% effective, especially when part of its effectiveness relies on forecasting what strains of a virus may or may not appear in a coming year. The truth is, with reasonably accurate forecasting, we can expect a vaccine effectiveness rate of around 40% in a given year, give or take. But that's just focused on someone getting infected, and there's more to it than that. An important point to convey to your patients is that even if they do get sick, the vaccine also can drastically lessen the severity of their flu, reducing the likelihood of someone dying from complications, reducing the length of ICU stays, as well as simply reducing the number of people who need to go to the hospital in the first place. So even if you do get the flu, you'll still be better off than if you hadn't gotten the vaccine at all. Number 3. But I don't get the flu anyway. Aside from cutting the chance of infection and drastically reducing the severity of the flu if someone does get it, there are 2 other key reasons why healthy patients should also want protection. For one, many patients have chronic conditions that they don't realize could be huge liabilities waiting to happen in the context of the flu. For example, while some patients with asthma or COPD might already be aware of flu complication risks and, hopefully, act accordingly, patients with congestive heart failure or maybe diabetes might not realize that those conditions can also increase both the likelihood of flu complications as well as the severity of those complications. But reason number 2, possibly the most important point you can make to a cautious patient. Let's assume that they're right. Maybe they actually are very healthy, and they don't see enough risk for themselves to get up off the couch to get their shot. Here's the thing about flu vaccines. They're not just for you. They're also for the people around you, many of whom might be in those higher risk populations. A healthy person can still act as a carrier for the flu, whether they're showing symptoms or not. And they could be unintentionally spreading the disease to their newborn nephew, their coworker with asthma, their neighbor with diabetes, or their grandfather with congestive heart failure. So the next time you ask your patient about a flu shot, do more than just check a box off your list. Take the time to open a real dialogue about the value of getting vaccinated. Because everyone wants to protect their loved ones, and getting the vaccine is one of the easiest things your patient can do to significantly help themselves and the people they care about.